As I mentioned, my name's Adam Smith. I work with Accelerated Benefits, and for those of you that were at the last crew meeting, some of this will be a review, but I know we did have some feedback, saying that it would be nice to at least go through this once we got through January 1st, which is actually your renewal date for all of your policies, and I know spouses were invited as well. So just the first thing I want to talk about is the fact that with Medical Mutual, as a refresher, you have what's referred to as a health reimbursement arrangement, okay? The health reimbursement arrangement that's built into your policy simply means that your employer is sharing in part of your deductible expenses. So when you received your open enrollment information for this year with Medical Mutual, there was a summary of benefits coverage included in there, okay? And that benefit summary showed that you have a $5,000 individual deductible, $10,000 family deductible, all right? Behind the scenes, that is true, but Janata and Herner is actually sharing in part of that deductible expense on your behalf. From your standpoint, nothing changes, okay? You still use your same ID card, you still go in to see your provider, you still receive care. But from a processing standpoint, Medical Mutual and your provider should work together to make sure that they process that claim correctly and that it does process with the health reimbursement arrangement, okay? But just from an administrative standpoint, no, it's there, but you should not have to actually deal with any of the claims behind the scenes. I mentioned the deductible. This is what is built in to your SBC, which is the document that was included in your folder. It shows a $5,000 individual deductible, $10,000 family deductible. You'll see your copays here, so most of you will use the plan just for your copays. So you go in and pay a $20 copay for an office visit, $40 for specialist. You do have urgent care at $50, emergency room at $75, and then you'll see your prescription drug as for a 30-day supply as well as a 90-day supply. Just remember, one of the ways you can put money back in your pocket is by utilizing mail order. You can get a 90-day supply a little bit cheaper than you can going to your retail pharmacy every single month and filling that prescription. So if you're on a maintenance medication, high blood pressure, high cholesterol, and we would encourage you to at least look at enrolling in mail order. The other thing I want to mention down below is your plan does have what's referred to as a deductible carryover. This is a benefit for you. It is somewhat unique in the industry, but it's a positive for you as an employee. What that means is any part of your deductible, okay, that you meet in the months of October, November, and December, so any deductible claims that you incur in those 3 months, they will actually be applied as a credit towards your deductible starting the following plan year. So what that means is if you had claims towards your deductible in October, November, December of 2015, starting January 1st of 2016 when your deductible resets to zero, Medical Mutual would actually apply a credit towards your account. So it means that if you've had those expenses, you won't be required to pay your entire deductible, okay? They're already going to show a credit towards that. Will cost you less throughout the remaining plan year in 2016, okay? So that's important. As far as the health reimbursement arrangement is concerned, I want to go through kind of step by step, what portion you are responsible for, what portion the employer is responsible for. We talked about how the underlying plan has a $5,000 individual deductible and a $10,000 family deductible, okay? You are not responsible for that entire amount. One thing I want you all to walk away with is if you are at your provider's office and they are telling you that you have a $5,000 individual deductible, you need to tell them they are wrong, okay? They need to contact Medical Mutual because incorrect information is being provided to them. I know we've had a number of instances in past years with that. I know we may have already had 1 or 2 this year, but if someone is telling you you have a $5,000 deductible, they need to dig a little bit deeper, all right, and actually pull up the HRA information. The second thing I want to mention is that if someone is telling you you have to provide payment up front, you need to push back on that provider. If they are saying, we can't treat you without a $1,000 upfront payment or a $2,000 upfront payment, you need to push back on that provider, okay? One of the things that's built into your contract is that you, the employee, should be able to receive care, okay, without making an upfront payment. If it is in-network, that provider has a contract with Medical Mutual. That contract says they must provide you with care regardless of if there's an upfront payment. Okay, so those are 2 things I want you to walk away with because we have had instances of that in the past. As far as the HRA plan, what you'll see here is that underneath that $5,000 deductible, you, the employee, are responsible for the first $750. So any of your inpatient claims, outpatient claims, MRI, imaging, things like that are first going to be subject to deductible, okay? When you hear the term deductible, think anything outside of a copay, okay? The way that it works after that is you, the employee, are responsible for 40% of the remaining balance from $750 up to the $5,000 deductible, okay? So you're responsible for 40% of the $4,250 that's left over. That is what we refer to as coinsurance. Coinsurance simply means you are no longer paying 100% of the cost. Someone is now sharing in those expenses, okay? In this instance, your maximum cost for coinsurance would be $1,700, okay? 40% of the $4,250. Your employer is picking up the other 60%, okay, behind the scenes. That will be billed to Janata and Herner. They will pick up that cost. The only other expense you could incur on this plan would be expenses for your copays. If you've met your deductible of $750, you met your coinsurance amount, the $1,700, the only thing you could pay thereafter is an additional $1,600 for copays. So that's your office visits, urgent care, emergency room, and your prescription drug copays. Okay, there is a cap on that, and that is mandated by healthcare reform. Okay, a couple other things I would mention just about the plan. Preventive care is covered 100%. So annual mammograms, PAPs, PSAs, things like that are covered 100%. Another thing to remember is blood work. I know we've had issues with employees going in, having blood work done, and if that doctor's office has an affiliation with the hospital, okay, that blood work could be billed as an outpatient visit. Okay? What that means is you are going to get a bill, and it's going to be very expensive. So it's important for you, to have a conversation with your doctor about, hey, can we send it to Quest? Can you send it to LabCorp? Okay, someone that contracts with Medical Mutual that may be outside of that hospital. Otherwise, it's going to cost you more, and then it's going to be a conversation between you and your provider's office of who's going to pay it. Okay, so also keep that in mind as you move into the plan year here in 2016. Couple examples of how that HRA works, and just in the first one, I know this is hard to read. If you have $2,000 in expenses, for that $2,000 claim, okay, you're going to pay the first $750, and then you're going to pay 40% of the remaining $1,250. So in that example, you're going to have a total expense here of the $750 plus 40% of $1,250, which is $1,250. Okay. Example number two. Let's just say it was a $500 expense. Because your deductible is $750, you are going to be asked to pay that entire cost. Okay? That coinsurance amount of 40% does not kick in until you've met your entire deductible. Number three down below, let's say that something serious happens to you, you go into the hospital, surgery, $7,500 in expenses. Again, you're going to be asked to pay the first $750 plus 40% of the remaining $4,250. In that instance, you've met your maximum out of pocket of $2,450. Okay? Your employer is going to pick up the other 60% of the cost from $750 to $5,000, and then the insurance company will pick up everything over $5,000. Okay? So there's just a couple examples, high level. Point being, if somebody tells you it's $5,000, push back on them. Your part of the deductible is actually $750. Okay? Any questions on that? Okay. Dental insurance. You received a folder, looked like this. This black folder had our accelerated benefits contact information in it. There was a benefit summary in here regarding your dental insurance. We did transition from Mutual of Omaha to Lincoln on January 1. There are a number of reasons for doing so. The number one reason was simply because of cost. With the transition, we tried to mirror the plan that you had in 2015. So what you'll see is that as far as the deductibles, it's still $25 per person, $75 maximum for the family. You'll see you do have in-network and out-of-network benefits. In your folder, there's a detailed summary of what's considered preventive, what's considered basic, and what's considered major. The one thing I will mention is while the percentages up here are the same, so 100% for preventive, 80 for basic, and then 50% for major. If you go out of network, you always run the risk of being balance billed. Because there is not a contract with an out-of-network dentist, they reserve the right or they have the ability to balance bill. Okay, so keep that in mind. Annual plan maximum is $1,000. Independents can be covered age 26, and then you'll see the rates listed down below. It's pretty inexpensive. Your employer subsidizes a big portion of this cost. So if you have not received an ID card, please let us know. ID cards were supposed to be mailed here to Julie, and she was going to hand them out. Unfortunately, they went out in the mail. If you have not received one, it's likely it's because it came in something that looks like junk mail and you threw it in the trash. So if that happened to you, let us know and we'll make sure that we get you an ID card so you can receive care. Okay, and if you didn't think that part was interesting, all right, this is really going to wow you, which is the part on healthcare reform, okay? Julie wanted me to just give you a quick reminder that we are working on your 1095s. That is one thing that is now required under the Affordable Care Act, which most of you know at this point has been around for almost 6 years. Biggest overhaul in the United States healthcare industry since 1965. You as individuals, are required to, have health insurance coverage. And we're going to talk in a second just about the penalties, unless you are eligible for an exemption. Most people do not qualify, but if you do, you won't be subject to a penalty. And then it also requires, as I mentioned, insurance companies and employers to add certain items to their policies. The preventive care was one of them. All the co-pays being covered underneath your maximum out-of-pocket was another. Doing away with pre-existing conditions, which we've had for a number of years now. As far as 2015 is concerned, you'll see healthcare reform does mandate that everyone needs to have minimum essential coverage. That just means you have a plan that meets the minimum requirements of healthcare reform, which our plan here does. There is a penalty for not having access to or not being covered under a health insurance plan, whether it's your employer plan, a spouse's plan, Medicaid, Medicare, or even enrolling in the exchange. You'll see the penalty for 2015 is $325 per adult. There is a cap for families, and that cap is $975. It is also a tax that could go all the way up to 2% of your earnings, and that is going to increase in 2016 to 2.5% of your earnings. So if you are someone in the room that is benefits eligible, has access to health insurance, and you are not enrolled, what will happen is when you fill out your taxes this year, you're going to be asked to attest to the fact that either yes, you were enrolled, or no, you were not enrolled in health insurance coverage for this year. If you were not enrolled and you can't prove that you had access to health insurance, you could be subject to what's referred to as the individual mandate penalty, and that is the amounts that are listed up here. Okay? 1095 form is one of the requirements of healthcare reform. I know we've talked about this last time, but it's a new form we're hoping to get out with your W-2s. It will be very similar to a W-2, except it's for health insurance. So it's going to tell the IRS you had access to health insurance coverage, okay? Your name's going to be listed up at the top, part 1, all your employee information. Part 2, we're going to tell the IRS, were you eligible, were you enrolled, and how much did it cost, okay? If we check all 3 of those boxes, right, eligible, enrolled, okay, and we meet the minimum cost requirements, you won't be subject to that tax penalty. If it was offered, okay, but you chose not to enroll, we have to report to the IRS that you may be subject to a tax penalty, so that when you fill out your taxes, they're going to take these forms, this 1095 that we submit to them behind the scenes, and they're going to reconcile that with your individual tax return, right? I know I told all of you this last time, and I'm sure this probably stuck in your mind. Please do not try to cheat the IRS. I don't have 100% confidence that they're going to be able to reconcile all of this within 2 months, but if by chance they do, just know that that's going to be between you and the IRS. Your employer has fulfilled their obligation of providing it to you in a timely manner, offering a plan that meets all the minimum requirements, and also making it affordable to you as an individual. So, point being, look for this within the next couple of weeks. They actually extended the deadline. The initial deadline was we had to provide this to employees by February 1. They realized a lot of employers were behind. They extended it to March 31st, but we're still pushing to get this to you within the next few weeks so that you can have that when you complete your tax returns, with tax return deadline being April 18th of this year. Okay? If you have any questions, we're here to help. I know this industry gets more and more complex every year. Healthcare reform, 1095s, co-pays, inpatient, outpatient. I mean, a lot of people deal with this, once or twice a year. It's hard to remember all of the information that's included in these folders and know exactly what all these terms mean. Your HR team is here as a resource. Medical Mutual is available as a resource, and our company is here as a resource as well. In your folder that you received just a couple weeks ago, there was a card in there that looked like this, kind of like an insurance card. This is our 5-star card. If you have an issue throughout the year that you just can't get resolved, billed incorrectly, providers telling you have a $5,000 deductible, can't get an answer from Medical Mutual, call us, okay? We deal with these types of things every day of the week, all right? I don't work for Medical Mutual. We work for your company and for you as an employee. So just know that you do have a resource available.
All right, thank you so much. And first off, thanks to all of you for having me today and being enrolled in the plan. Before we begin, I know it's kind of lame that I have to do this, but I gotta make sure the attorneys at Rowe Price are happy. Otherwise, my life gets really, really difficult. What this slide right here states is I'm not in the business of giving any legal or tax advice. I'm not gonna tell you guys how to not pay the IRS. It's probably not a good idea anyway. I'm also not gonna give you guys any legal advice as well. But I really encourage you guys to ask your questions, whether it's in this form or when I'm in the office. If you got a tax question, ask me your tax question. You got a legal question, ask me your legal question. Just know I'm not going to be any kind of advice-giving business when it comes to the legality of investing or taxation with investing. So to introduce myself formally, as stated earlier, my name is Bray Gill. I am a Rowe Price retirement specialist, flew in from Colorado Springs, Colorado, so you guys kept the cold. Thanks a lot, I guess. It's a little windier here, though, I must say, but I'm glad to be here. I've been to Ohio many times. This is the furthest west I've been out in Ohio, so it's kind of cool to see new areas of the state. And just to let you guys know, I know what I'm talking about. I do hold my FINRA Series 6, FINRA Series 63, FINRA Series 66, and FINRA Series 7. Basically, if you got an investment question, I can definitely answer that question for you. So please don't hesitate to ask me whatever questions you have. So as far as what we're going to be talking about today, there's some stuff on here. Yeah, the main thing I want to talk about is how to do your retirement checkup, how to make sure we're doing the right thing. And before we even talk about making sure we're on the right path, let's all just take a quick second. Maybe not close your eyes. I might lose you if you close your eyes, but just think about what is retirement to you. Because I do this for a living. I travel all over the country. I talk to many, many, many people, and the most fun part of the conversation is asking what they want to do for retirement. Because I can reassure you, all you guys have much different goals. And so we are going to talk about some things on how to make sure you're on the right track, but at the end of the day, retirement is different for everybody. Maybe Patty right here wants to stay here. I don't know if you even live in Monroeville, but let's say you do, and then watch the grandkids. Maybe this gentleman right here wants to go somewhere else, maybe where it's not cold, like a beach, I don't know. Or maybe someone else wants to buy an RV and travel the country. All three are very realistic and achievable goals, but the most important thing to know is they're all going to require a different dollar amount. So for those of you who may be way far away from retirement and thinking, I have no idea what I'm going to do. How am I supposed to know that, right? That's okay. That's totally okay. And how we're going to make sure you're on track is just follow Rowe Price's recommendations and resources. We've been in the business since 1937. I like to think we know a little bit about retirement and how to get you guys there. So we're going to help you guys get you in the mindset of, if I know what I want for retirement, what are the things I got to do? And if I have no clue, well, that's okay. We're going to give you a nice path to follow, so that way when you do know when you want to retire, you'll have an idea of what more you can do. That's what we're going to focus on. We're going to focus on the fun stuff, retirement, what you guys want to do, and how we can make sure you guys get there. Oh, I was going to give you guys a pop. Okay, cool. I didn't overclick it. Sometimes I overclick it and I blow away the answer. So let's give you guys a pop quiz. Make sure you're all awake today. So what percentage of working people are currently saving for retirement? What do you all think? You can shout it out. I know it's a crazy room. We might get chaos, but what do you guys think? A lot of pessimists out there, huh? Understandably so, yes. A lot of people aren't saving. The good news is it's not C. The bad news is it's not B. The bad news is it's not everybody. Only 51% are currently saving for retirement. Did a little bit of research before I do these meetings, and this is 2 years ago. The average balance in an average person's retirement account is $2,500. 40% of people have access to a retirement account. Think about that. Think about how fortunate you all are to have this service available to you. And for those of you who have a balance, you're about as good as 50% of the people in the U.S. For those of you who have a balance greater than $2,500, you're better than the average person in the U.S. Now granted, $2,500 is not enough to retire on, but the idea is, understand, this is hard and not a whole lot of people are doing it. So the fact that you guys are actively doing something, give yourself a pat on the back, round of applause, maybe not right now, but make sure you celebrate your guys' success. Not a whole lot of people are doing this, which is sad. And that's why I'm here in front of you guys today, to make sure you guys know the importance of saving for retirement. One more question for you guys. Make sure to overclick this again. What percentage of people have calculated their financial needs for retirement? What do you folks think? B. Okay, pessimistic, you're 100% right on this one. We should be pessimistic. Not a whole lot of people have calculated their financial needs for retirement. And one, we just talked about it. What if I have no clue? How do I calculate a financial need on nothing or unknown? And other people who do have an idea haven't really got down to the numbers. So we're going to talk about some rules of thumb, if you will, as far as what T. Rowe Price believes people should calculate their financial needs for retirement, how we're going to get there. And like I said, if you feel like your situation is different, that's wonderful. You're actively thinking about retirement. So you can make the adjustments as necessary, but just understand this is kind of our rule of thumb and how we're going to work with this. So T. Rowe Price believes most people are going to need to replace 75% of their yearly salary in retirement. That's with the expectation we're going to be living the same lifestyle that we are today. So for those of us who are like, you know what, there's no way, man, I'm buying a plane, I'm going to buy a boat, I might buy all of them, right? Well, we all know we're going to probably need to save more than 75% of our yearly income. And for some of us who know, hey, I'm going to be doing the same thing, or I may be even doing less. I'm going to make all my kids and grandkids take care of me, because dang it, I put in the hard work. Time for them to pay it back, right? That's also a viable option. But the most important thing I want you all to know is we got to make sure we're saving enough so that way we have that option. I've talked to many of folks and many difficult conversations where, they didn't quite save enough, and I have to tell them, well, you know what, that particular goal may not be realistic to make sure you don't outlive your earnings. It's a difficult and tough conversation, and that's why I'm here today. I don't want to have that conversation anymore. I want to get in front of you guys beforehand and talk about how we can make sure we have those options, we have that flexibility. Now, as far as where we get that 75% from, well, generally speaking, and once again, some people will laugh depending on your view of taxes and whatnot. I'm not here to get in that conversation. But generally speaking, people take home 75% of their pay now, after they're paying into the taxes, Social Security, paying into medical expenses, and saving for their retirement. So generally, that's where we pull that number from. You can live the same standard of living off of 75% of your income, because in retirement, those expenses aren't going to be there right away. We're not paying into Social Security anymore. We're not saving for retirement. Well, hopefully we're not saving for retirement in retirement. I'd like to know how you're doing that one. But that's where we come up with that number. So as far as consider expenses that may change, the main thing I want you guys to know is just think about what you think you'll be doing in retirement. For some of us, our mortgage may go down. It may disappear at all because we're going to stay at the same place. We're going to live where we are now. We're happy where we're at. Some of us, we may want to buy a different home. We maybe use the leverage from our old home to purchase a new home, what have you. But the whole idea of this exercise is to get you guys to think about what you want in retirement. And understand that what you want will have an impact on how your expenses will change from today to retirement. And the one big thing I definitely want you all to be aware of is especially that health and life insurance costs. That's something that is guaranteed going to change, regrettably, as you get older. And regrettably, as you get older, it does get more expensive. A lot of the reason why people retire at 65 is because you're not eligible for Medicaid until 65. So if you plan on retiring early, how are you going to pay for those heightened medical costs? That's definitely something else to be aware of as well. So definitely taking all the considerations when thinking about your retirement. Think about how your money is going to be spent. And once again, this kind of gives you an idea of an out-of-place slide for some reason of where we came up with this number of the 75% of your salary. Once again, your earned income, and then once you're paying into Social Security and whatnot, that's why we have that number of 75%. And once again, just keep in mind, if our retirement's different, if it's looking different, if we're more ambitious, we may need more for retirement. But once again, this is just kind of a rule of thumb to get you guys on the right path. Sources of income in retirees. We did a survey to see where sources of income come from retirees. And a lot of people feel like their earned income was going to be a primary source, and that happened to be the case. So some of us maybe worked part-time, maybe continue working the whole way through. I've actually met a young lady in Utah. She works for a hospital, and she saved an obscene, I saw the account, it was pretty obscene how much she had, but she just loved working. And she said she joked around she couldn't stand her husband that much either, but that's neither here nor there. The main thing is understand there's no right or wrong way to retirement. We just want to make sure you guys have that flexibility in retirement. Understanding where your income can come from. Think of your earned income, maybe your savings account. Definitely consider your retirement plans. This particular account, any other IRAs. For those of you who have a spouse or brought your spouse, and maybe you have the crazy idea of spending it with them, well, you may want to include their idea as well as far as what they're bringing in for retirement income, if they have a 401k, if they have an IRA, and also consider Social Security as well, depending on what your view is on that, of course, as well. So we kind of talked about the exciting part about retirement, thinking about how we're going to spend the money. Well, now we got to find out the most important part of, is the money we're putting in going to be enough? So a lot of people feel we're alone in retirement. And I want to implore you guys, we're not alone. We have a lot of people in your corner. First off, your company has established this wonderful 401k plan for you. Because remember, only 40% of the people don't have access to a 401k. You're not one of those people. Your company is also putting money into the account for you. They're going to help you do the most important thing for saving. And last, I want to talk to you about what T. Rowe Price can do to help you on making sure you're on the right track. So by a show of hands, has anyone been on the website with T. Rowe Price before? That's awesome. A lot of you guys have. So for those who haven't, hopefully after this, you'll definitely want to get online. And for those who have, maybe we're going to show you guys something you've never seen before. But one thing I want to direct you guys to is our retirement income estimator. This is a great way to kind of check the pulse on your retirement. Check our progress. Because at the end of the day, it's a long way away. And sometimes we're not sure if we're doing the right thing. This will see if you're on the right track. So the great thing about all of our tools, we're going to ask you for all your information. But pretty much we're going to tell you what T. Rowe Price thinks you need. And we'll show you, based off your current actions now, what you're going to have in retirement. So that way you know, hey, you know what? I'm not putting away enough. I can make the change now before it's too late. If I know I'm maybe not invested properly, I can make the changes now. Call the T. Rowe Price now instead of making the changes later. So you'll put in your information there. I encourage everybody, when you go into the portion of what's your annual savings of that percentage, make sure you include the company match. That money's going into your account. So definitely make sure you include that, because that's money that's a part of your account. On the right-hand side, it will kind of tell you as far as what you have, what T. Rowe Price thinks you'll need, and so on. All of our assumptions, taking the assumption that your retirement savings need to last till 95, and that you'll need to replace 75% of your annual salary. But once again, if you want to tweak with those numbers, you're definitely more than welcome to. If you feel you need to save more, then go ahead and beat our expectations, so that way you can save more than 75% of your annual salary. So to find that information, just go to the Tools tab. We've seen this before. This is the account. Some of us hopefully have that number even larger into the account. But this is where you'll find the information on the Tools tab. When you enter it the first time, we'll ask for your annual salary, and then if you want, you can put in your retirement goal. So for those who are more ambitious, I don't want to live off 75%. I want to be able, I can buy me a yacht, even though I'm in I guess you guys aren't landlocked. I'm used to speaking in Colorado. But if I want to buy a yacht, whatever you want to do. But this will give you the idea of, are we on track to meet our retirement goals? So this gives you kind of a close-up view of the tool once again. And once again, we're going to ask for your information. There's no cookie-cutter way to retirement. You guys got to provide us the information. We also ask if you want to include Social Security. We also want to ask if you have any other kind of retirement accounts, whether it's an old 401k or a pension. Because once again, this 401k it may not be your only source of retirement. So you definitely want to include other retirement income sources. And then last, it'll show you where you are as far as what you'll have in retirement, what you'll need, and what T. Rowe Price thinks you'll need. Or as far as what T. Rowe Price thinks you need and what your goal is. So that way you know, if I'm not on track, I need to make some changes. And guys, let me ask you this. What is the most impactful way to affect your retirement? What do you guys think? Shout it out, don't be shy. I'm sorry? Save early. Save early. The most important thing if you want to impact your retirement today is you got to save. Simple as that. You can have the Warren Buffett strategy of investing, but if you're only putting away 1 or 2%, that's the minimal effort you're going to get. So understand, if you are short, the easiest way to hit your goal is to put more money into the account. We're going to talk about that impact in just a second. As far as IRS changes to 2016, there are no changes. The limits have stayed the same. So it's $18,000. That's the amount you can work with, and your IRA limits did not change as well. So you guys can put in as much as you want up to the IRS limit of $18,000, and anyone over 50 can put in $24,000. Your IRAs have no impact on your 401k account, so if you guys are overachievers, you can put in your $5,500 in your IRA as well and not have any impact on your 401k. The last thing I want to show you guys before I talk to you about the benefit of saving is a tool that can show you guys how saving more will impact your paycheck. So we have a tool on the website called the Paycheck Impact Calculator. When you launch that tool, you'll put in all your information and we'll tell you if you raise your contributions 1 or 2%, it will show you what that difference is. So that way you have an idea to better manage your money. For those of you who are definitely into your budget, you want to know if you have a little more wiggle room to contribute more into the account, this is a wonderful tool that's available to you. Once again, like all of our tools, they're free to use on the website. So I strongly encourage you guys to check out our tools. We have a lot more than just the 2 we talked about today. So once again, if you're not on track, the most important thing you can do is put more money into the account. You can also consider your investment strategy. And once again, T. Rowe Price is in your corner. If you want to talk about your investments, give us a call. That's what we're here for. The great thing about working with T. Rowe Price, in my opinion, is that we're not trying to make a commission off you folks. So it doesn't impact us if we move you in a certain stock or we recommend a certain stock or bond. That's not how we make money. We make money by you guys being successful and having that successful retirement. So we're not going to try to force you into something that's not appropriate for you guys. We want to find the best investment strategy for you folks. So please, give us a call and use us as that free resource. And last but not least, I like to kind of end off with this slide here to talk about the power of saving more, the power of time, and how much 1% really is in the big scheme of things. So this person right here saves 2%. They never change it. They save for 30 years. They have $80,000 available at retirement. To be fully honest, folks, I'm kind of a straight shooter. It's not going to be enough to retire off of unless you love the college kid diet, which is Doritos and ramen noodles in case you were curious. So for those of you who wants a little bit more nutrition in your retirement years, maybe enjoy some good food. There's a lot of good food out there, trust me. This person wants to do more. So they're going to save more. But this person also can't be like, you know what, I can't just jump up 5-10% right away. And that's totally understandable. So this person is going to raise their contributions 1% every year and stop at 12%. What do you guys think that change will look like at the end? You think it'll be huge? I mean, hopefully no one's losing money if you put more in, right? That'd be kind of scary. That's definitely not the case in this example and most scenarios as well. This person sets up their increases. They raise their contributions annually. They have a $300,000 increase. And all they did was raise 1% every year. That's all they did. Think about how much 1% really is. 1% is $10 for every $1,000 you make. So that's one less Subway. Honestly, I tried to find a place to eat here, guys, and I don't know if I went the wrong place, but it's not a whole lot of options here. So I guess I did see a Subway, so we'll say that's one less Subway trip a pay period. I think we can all be in a better shape and understand that our retirement is our future paycheck. And just like our current paychecks now, it makes us feel really good when we get that raise every now and then, correct? Well, understand your future self would love that raise as well, because that gives your future self more flexibility and opportunity in retirement. So make sure you take the time to give yourself that future raise. Because this is where your future paycheck's coming from. It's coming from you guys. So I implore you guys, go on the website. Do your retirement checkup, if you will. We kind of talked about our medical benefits. Luckily, we don't have to worry about any kind of health care acts or nothing like that. But check on yourself. Check on your retirement status. Use our tools. They're free to use. If you want to talk with someone on the website at Rowe Price, or not on the website, if you want to talk to someone over the phone, please give us a call. But I encourage all of you guys, use that retirement income estimator, see if you're on track, and if you have questions, know that we are the other piece that's in your corner for your retirement, because you are not alone. Your company's got your back, and Rowe Price wants you guys to be successful. But all we ask of you guys is to give yourself that future paycheck. Make sure you're putting money away. This is our phone number in case you guys need it. And once again, thank you so much for inviting me here. Thank you so much for your time.